I got a request under one of my videos recently. Somebody wanted me to do a video on gynecomastia, so that's what this is going to be about, gynecomastia. What is gynecomastia? Gynecomastia is basically the formation of excess glandular tissue in men's breasts. What happens usually, it presents itself as a little, starts out, first you get like an itchy feeling around the nipple. I'm talking, of course, about men. And then you eventually get like a little nodule underneath, right underneath the nipple. If you look at photographs, this started around maybe the 1970s. It's when gynecomastia first started to appear in male bodybuilders. It was most apparent when they lifted their arms, like when they lifted their arms down like that, you really couldn't notice the gyno. But as soon as they lifted an arm, you lifted your arms up, it kind of stretched the pectorals. You could see the nodule. You could look at photos from that era. You'll see quite a few bodybuilders that had gynecomastia. I'll just talk about that now. The main cause, of course, for gynecomastia is usually an imbalance between estrogen and testosterone. Estrogen is usually thought of as a female hormone, but estrogen is produced both in men and women. Women produce considerably more estrogen, although men who take large amounts of steroids can actually produce more estrogen than women, but through the process of amortization, which involves the enzyme aromatase converting testosterone into estrogen. That's another story. But basically, what happens is when you take large amounts of steroids, a lot of the testosterone is converted by the hormone aromatase into estrogen. As I said, the estrogen is normally produced in the male body. 15% of estrogen is produced in the testes, along with testosterone. The rest of it is produced through the aromatization process. Basically, you have aromatase is all over the body, this enzyme, particularly in fatty tissue in the peripheral areas, the legs and the arms. It's in the brain, it's in the muscles. So again, large amounts of testosterone will encounter this aromatase enzyme and be converted into estrogen. Now, a lot of people don't realize is that there's a form of gynecomastia called non-physiologic, or actually it's I got it backwards. It's physiologic gynecomastia, meaning this is like normal gynecomastia that has really nothing to do with drugs, but rather results in a transient imbalance of estrogen to testosterone ratios. For example, most newborn babies are born with a little bit of gyno because while they're still in their mother, they are exposed to fairly large amounts of estrogen. So they come out with a little bit of gyno. You don't notice it because, a baby's fat and he's got these little, he doesn't have much pectoral muscles, but it's there, and it usually disappears after about 4 weeks. It's transient. The next time gyno shows up naturally is during the adolescent stage. Teenagers, a lot of teenagers there's hormonal imbalances occurring because some hormones are getting lower, some are there's imbalances with testosterone and estrogen. To make a long story short, dehydrotestosterone goes up, causes teenage acne. But for a brief time, in about half of male adolescents, so teenagers, wind up getting a transient gynecomastia due to a little bit more estrogen in relation to testosterone. Again, it's transient, it disappears, they don't need surgery. Sometimes it does last longer, and that requires some medical treatment or possibly surgery but in most cases, the adolescent or teenage gyno is short-lived. It doesn't last very long. The third time that men get gyno is when they're older. When they're over 50, what happens is you have an imbalance between testosterone and estrogen, especially in men who have more body fat. What happens is the levels of free or active testosterone tend to decline, while the levels of estrogen, the levels of estrogen don't change that much, but because of the decline in free testosterone, estrogen now starts to dominate a little bit over testosterone. And when that happens, you get the same stimulation of, estrogen receptors in the breast, and you get gyno. So those are the three stages where gyno appears naturally. Of course, the other type of gyno is caused by diseases and drugs. Certain types of tumors, certain drugs can do it. Of course, anabolic steroids, testosterone, and there's a bunch of other causes. I'm just going to read them off. You can get primary hypogonadism. In other words, if you're naturally low in testosterone, you'll get an imbalance between testosterone and estrogen, and you can very often get gynecomastia. 5-alpha reductase deficiency. What happens there is the 5-alpha reductase is the enzyme that converts testosterone into a metabolite called dehydrotestosterone, DHT. But in the process, you get an increase in estrogen, which can also cause gynecomastia. There's hemochromatosis and excess iron deposition in the liver can cause gynecomastia. Testicular trauma, any trauma to the testes can cause gynecomastia. Adrenal tumors, stomach cancer, lung cancer, testicular tumors, hyperthyroid, elevated thyroid hormones can also cause gynecomastia. A lot of people don't realize that. Chronic renal insufficiency, in other words, kidney problems, can cause gynecomastia. So, those are some of the diseases. Some of the medications that can cause it include, some of the marijuana. Excess amount of marijuana can cause gynecomastia. Stimulates estrogen. A lot of people don't realize that. Spironolactone, aldactone, a diuretic commonly used by many bodybuilders to lose water. Spironolactone or aldactone can also cause gynecomastia. It interferes with estrogen metabolism. It actually blocks androgen receptors. That's how it causes, which causes an increase in estrogen, and that's how you get gyno from aldactone. Of course, anabolic steroids, Valium, digoxin, which is used to treat heart disease. Estrogens, of course, estrogens are going to cause gynecomastia. HCG can cause gynecomastia. A lot of men use HCG along with testosterone, but HCG will stimulate testosterone production in the testes because it mimics luteinizing hormone, but it also unavoidably stimulates estrogen production. A lot of men don't realize that. Any kind of phytoestrogen, for example, large amounts of soy, 300 milligrams a day or more of soy, can in some men stimulate gynecomastia. Normal amounts of soy, low amounts like 25 grams a day of isolated soy protein, will not stimulate gynecomastia, contrary to what you read on the internet. It takes very large amounts of soy. I remember one case where a guy was drinking, I believe it was 5 quarts a day of soy milk, and he got a raging case of gyno. But that was ridiculous. He was taking in massive amounts of phytoestrogens, which are basically isoflavones that are structurally similar to estrogen, and in large amounts they can mimic the effects of estrogen, although they only have 1/10,000th of the potency of actual estrogen. But in large amounts, that's enough to stimulate the estrogen receptors. You can get gyno. As I said, diazepam, Valium, that can cause gyno. There's a couple of other drugs, finasteride or Proscar. A lot of men use that to prevent hair loss. In some cases, that can cause gyno, not very often. What else? Methyl-dopa, minoxidil, which curiously is also used to control high blood pressure and as a topical preparation to prevent to stop male pattern baldness, can also cause gynecomastia. And most of these drugs, I got to tell you, they work by interfering with either androgen receptors. In other words, they tend to block androgen receptors, which cause estrogen to build up, or they themselves somehow increase estrogen. So those are the drugs that can do it. Let's see, what else can I tell you here? I talked about the tumors, this and that. Exposure to phthalates, which are often used in plastics and various bottles and all that kind of stuff. That can cause a hormone imbalance, which can, in favor of estrogen, which can also cause gynecomastia. Any kind of mechanical stress, testicular injury, I mentioned. What else? Let's see here. Oh, let's see. Anyway, well, the thing to look for is, like I say, it starts out with an itching right under the nipple. I'm talking gynecomastia. Starts out with an itching under the nipple, and then it develops into a nodule. Now, the question often arises, what do I do now? If I'm starting to get this obvious little nodule or little hard marble feeling under the nipple, what do I do? Well, it all depends on how long you have it. If it's in the early stages, there's a number of ways you can cause it to recede. One way is to use Novadex or tamoxifen citrate, 10 milligrams a day is probably the most effective drug. Surprisingly, studies that compared it to aromatase inhibitors, which are other drugs which actually inhibit the enzyme aromatase that converts testosterone into estrogen, when they've compared them head-on, tamoxifen, which works by blocking estrogen receptors, it doesn't actually prevent the production of estrogen, it only blocks the receptors. Tamoxifen actually, in the early stages of gyno, works better than aromatase inhibitors, probably because it has a little bit less side effects than aromatase inhibitors. But so tamoxifen is probably the best drug to use in the early stages. It'll cause the gyno to recede because it blocks the estrogen receptors. By the way, I should also point out that the extent of gynecomastia depends on genetics. There's a lot of men over the years that have used, even without taking any aromatase inhibitors or tamoxifen or Navadex, they've used large amounts of steroids and did not get gyno. How do we explain that? Because their body is converting a lot of that testosterone into estrogen. Why didn't they get gyno? Very simple. It has to do with the number of estrogen receptors in the breast area. The number of receptors in the breast area, estrogen receptors, depends on genetics, meaning you inherit that characteristic from your mother. If your mother had a lot of estrogen receptors, you as a male also have estrogen receptors. Of course, they're dormant most of the time. Otherwise, you would have breasts that look exactly like your mother. So, if these estrogen receptors are stimulated, if your mother had large breasts, you can get a considerably worse case of gyno. However, the men that don't get gyno, even when they take steroids, their estrogen receptors are either fewer in number or not as responsive to estrogen. So even though they're being exposed to larger amounts of estrogen through the use of steroids, it's not causing any reaction in their breasts. In other words, they're not getting any gyno. So the first line of defense, if you're starting to see that little nodule, is Navadex, about 10 milligrams. If you don't want to take Navadex, you could take aromatase inhibitors, for example, anastrozole, also known as Aromadex, 1 milligram. The problem with the aromatase inhibitors is that they're very powerful. They knock out anywhere from 80 to 90% of estrogen, which in the long run is very unhealthy for men. I've done other videos about the effects of estrogen in men. I'm not going to get into it here, but you don't want to stay on aromatase inhibitors, especially at the full strength. For example, anastrozole, 1 milligram a day, is very powerful. It's normally used to treat postmenopausal breast cancer. And, you don't want to stay on that for any length of time. Believe it or not, in one study, I can't remember how many study subjects, but they actually administered anastrozole or Arimidex to men with the early stages of gynecomastia, and it failed to work in 80%. 80% of these men, the Arimidex didn't even help the gyno. So that's another thing to consider. I think that whereas tamoxifen or Navadex has shown a much better success rate. So I personally think that for the early stages of gyno, Navadex or tamoxifen citrate is the better choice between the two drugs, and it won't mess up your natural estrogen system. Your body will still make estrogen. It'll just block the estrogen receptors, so it'll cause the gyno to recede because it's not getting estrogen stimulation. I should also point out there's another hormone called progesterone. Now, for example, certain anabolic steroids such as Durabolin, Decadurabolin, these are called progestoid steroids because they're progesterone-like in structure. Theoretically, in large doses taken over an extended amount of time, drugs like Decadurabolin could also cause gyno, not so much from the estrogen, because only 20% of Decadurabolin is converted into estrogen, but rather because of the progestin type effects. Progestin can also cause a type of gyno. Now, the third option to treat gyno, which I think is actually a pretty good option, this has been around for years. A lot of men don't know about this. It's called DHT, a topical DHT preparation, basically a DHT cream that you actually put right on the gyno. They do sell this over the internet. I've seen it sold over the internet. DHT blocks the effects of estrogen when it's applied locally. In other words, it works just like Navadex and just like aromatase inhibitors. It basically short circuits the estrogen stimulation of the glandular tissue in the male breast. As a consequence, the glandular tissue regresses. So, because the DHT is local, in other words, it's only used topically on the gyno. It doesn't get really, a lot of it doesn't get into your body. It's not absorbed into the blood, so you won't get the DHT-related side effects such as male pattern baldness stimulation, possible prostate stimulation, and acne. You won't get that from the DHT cream. The DHT cream might be a very good option. I think, I could be wrong, but I believe you can actually get this without a prescription. You could buy it off the internet, but again, here's my warning. I've said this in previous videos. The internet is a wild, wild west. I mean, you never know what you're getting when you buy drugs and stuff over the internet. It may or may not contain the ingredients that it's supposed to. It might not contain enough of the ingredients. The ingredients might not match the label. So what I'm saying here is that even though DHT topical preparations are available over the internet, I can't guarantee that they actually contain DHT. I would contact the company. In other words, if you're thinking of using this route, using DHT topical to treat gyno, contact the company first and ask them if they could prove that their product, for example, some sort of lab analysis, something like that, ask them if they could prove that their product actually contains the correct concentration of DHT. Another option is to go to a formulary pharmacy where they could probably actually make DHT topical for you. They just basically grind it down and put it in a let's say an oil vehicle, and boom, there you have your DHT. That might be the better way to do it, because in that way you're 100% sure you're getting actual DHT. I don't know how much it costs to do that. It might be fairly expensive, but at least you're assured that you're getting the real stuff. So now the final thing to consider about gynecomastia is, unfortunately, if it lasts too long, if you don't treat it, it very often becomes fibrotic. In other words, it hardens up, it becomes like a piece of scar tissue. And that means that nodule is going to stay there. No amount of estrogen blockers or aromatase inhibitors or DHT, once it hardens up, it's there. It's not going to go away. In that case, your only option is surgery. And the surgery, there's various ways to do it. They remove a lot of the, they basically, a plastic surgeon do this. They open up the area, they remove a lot of the fat and glandular tissue, they remove the nodule, boom, there's the gyno, it's gone. It's gone. That's your ultimate treatment. And like I say, that usually only is an option if you've waited too long, if you've not treated the gyno and it's hardened up or become fibrotic. The only way to treat it is surgery. In most cases, if you catch the gyno earlier, and again, things to watch out for, you get a little itching around the nipple, then you start to get a little kind of marble underneath there. It feels like a little nodule. That's the gyno. That's the time to immediately, you probably should start treating as soon as you get the itchy feeling. If you get that persistent itchy feeling, do one of the options I mentioned. Get either Navadex, aromatase inhibitor, or preferably the DHT lotion or cream. Put it on. It'll nip the it'll stop the gyno right in its tracks, and within maybe, I don't know exactly how long, a couple of days, maybe a couple of weeks, the gyno will recede and disappear. You won't have to get surgery. So don't wait too long. If you have gyno, don't wait too long. And I guarantee you, if you use large amounts of steroids, particularly testosterone and a lot of those androgens, not the DHT-based drugs. Some of the steroids are, for example, primobolan and several others. I believe Winstrol's another one. These are based on the DHT structure. They do not aromatize into estrogen, so you don't have to worry about gyno with those steroids if you use them. But however, testosterone and a lot of the androgenic steroids, they definitely will convert into estrogen. If you use large amounts, if you have the estrogen receptors that you inherited from your mother, you will get gyno for sure, unless you do something about it. A lot of bodybuilders don't even take a chance. As soon as they take the steroids, they take either Navadex or aromatase inhibitors with it. But like I say, you don't want to stay on anything that blocks or interferes with estrogen for extended times, because you need a certain amount of estrogen to stay healthy. So let me see, can there anything else I can add? I think that's about it. That's all I can say about gyno. I think that really covers the waterfront. If you want further information about nutrition, exercise science, supplements, hormonal therapy, including ways to treat gyno, women's health and fitness, fat loss techniques that really work, anti-aging research. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. It's 40 to 50 pages every month. No advertisements, pure information, evidence-based, based on my over 57 years of empirical and academic study. Everything I've learned I put into this newsletter. If you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on nutrition, exercise, and general health and medicine and preventive health. I also have an email portal on my Applied Metabolics site where subscribers, only current subscribers, are welcome to ask me short questions, either about anything I wrote in the newsletter or anything that comes to mind that they want to ask me about. It have to be short questions. I don't have the time to give 5-page answers. It'd have to be fairly short, but I will do that for the subscribers because I appreciate your subscribing to my publication. What else? You can also leave comments underneath underneath the videos. If you want to leave suggestions for future videos, that's fine. But as I said in another video, I don't do, even though I talked about gyno in this video, and I had passing mention of steroids, I don't do steroid videos. I won't talk about how to use anabolic steroids or steroid cycles or how to use growth hormone and that kind of stuff because it's verboten on YouTube. Google frowns upon that, and they will remove a YouTube channel if there's too much stuff on steroids. So ain't going to happen in this channel. If you want information on steroids, you'll have to look at one of those other goofy guys that does the YouTube stuff on steroids, which, by the way, 90% of what they tell you is completely wrong, but that's another story. Anyway, take care, and thanks for listening. And if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Take care.